Hello, my name is Lance Weller. I'm a professor in the Department of Biostatistics and Bioinformatics in the Rollins School of Public Health at Emory University. I'd like to share a little bit of my research interests. So I'm interested in statistics for public health surveillance. Public health surveillance is defined as the ongoing systematic collection, analysis, and interpretation of health-related data for planning, implementation, and evaluation of public health. I think it's key that it's ongoing, it's systematic, it's designed, it's for the analysis, planning, and evaluation, three different uses. It really comes down to how do you find a problem? We need to know what we're looking for. What's the signal we're trying to find? We need to know what we're not looking for. What's the noise that's hiding that signal? And how do we find a problem in there that's worth solving? It's not just did I find it or not, but how do I do it better? Some examples will be monitoring the annual influenza. Does a vaccine match? How do vaccine coverage that varies from place to place impact the outbreak or spread, like of measles or flu? Ones I'm particularly working on are the boldface ones, outbreak detection or monitoring, looking for clusters of disease, whether that's infectious disease or environmental reaction or a chronic disease like cancer. Reportable diseases, we work with zoonotic diseases such as bubonic plague or rabies, neglected tropical diseases in other parts of the world, and then the goals of disease eradication. Outbreak detection is going to focus on identifying an increase in risk accurately, reliably, and fast. How quickly can you detect a change but not get tricked by just the noise over time? Where should you be monitoring? How do you monitor? How often do you monitor? And we're interested in things like, is it accurate? Is it sensitive and specific? Is it reliable? We can measure things like the positive predictive value. Once your system says you found something, how likely is it that's true? Or alternatively, the false discovery rate. What's the chance that your discovery was false? And at fast, we might be going too fast to be accurate and reliable. So these are all competing goals. When we're looking at zoonotic diseases, this is the field of disease ecology. So if each one of these is a map, we might have where the hosts are. So for Lyme disease, these might be deer or mice. We have the vectors, which are the ticks. We have which ticks are infected by the pathogen associated with Lyme disease. All these interact dynamically with the landscape and climate and people hiking, and how does that all interact to give us the true map of which people are exposed where. This is the ecology part of the transmission between different hosts and the interaction with the environment. On the public health side, we don't get to see the true cases. A case in a certain location has to go to the doctor and be diagnosed, and some diagnosis is accurate, and some cases might be missed for some time. So there's kind of a filter map here, where the map of diagnosis cases show up, and then they get reported to, say, the state health department or the CDC. And some counties might report quickly and some might be slow. So there's another map that's a filter that gives us to the map of the reporting of the reported cases. In public health, we often start on the right-hand side of this figure and try to work our way back through statistics. And in ecology, we often start with maps on the right-hand side and use mathematical models to try to describe how the cases might appear. In the animal disease examples we've been working on in my work, we've worked with the California Health Department on surveillance for bubonic plague in ground squirrels and coyotes. The cases in humans are rare, but it's very serious. So trying to get a sense of where the infected ticks and, or sorry, for bubonic plague, it's fleas and ground squirrels are can help make maps of risk and give notice to campgrounds and so on. And we combine that with environmental data on climate, including temperature and precipitation. And another area, we might simulate what if there was an increase in an area? Can we see how different sampling plans would work? So how can we find these hot spots reliably, accurately, and under budget? Ian Buller was a former student who worked in the Environmental Health Sciences Department, and his work with California generated maps like this, indicating air. It doesn't say that plague is guaranteed in the red areas, but it says those areas have the combination of climate, elevation, temperature, and precipitation that's consistent with identifying ground squirrel or finding ground squirrels that were seropositive for plague. And then he extended the model over the Western US. So in disease eradication, the goal is to eliminate a disease, but we've only done that with one human disease, and that's smallpox. But other ones are close, like guinea worm. The first steps are to eliminate it locally, and that in order to be eradicated, a disease needs to be focal. Outbreaks have to stay in a place, and we have to have a safe, effective, and affordable treatment. We have to monitor for when cases are outbreaking. And the statistical surveillance problem is how do you monitor for this, and how do you come up with an efficient sampling plan? As the disease becomes more rare, as you're successful, it gets harder to find them. So there's a lot of interesting statistical challenges there. So in summary, the surveillance differs from designed experiments like clinical trials because the data are observational. Our data often comes from multiple sources. There's multiple interests and drivers for collecting the data, and there may be different performance and different quality of data for different outcomes. So design is important. We want to do smart things, but so is modeling. So as a faculty member, a professor of mine in graduate school once told me, design what you can and model the rest. So thanks. I'd be happy to talk to anyone who's interested and see about graduate studies at Emory. So thanks for your time.